This video is about some of the decisions I'm facing and what it's like to be making choices, choosing between multiple options that can have maybe a dramatic effect on length of life and quality of life. I'm going to try hard to make it not sound like a complaining video, although it is extremely difficult to be looking at a wide range of information of varying quality, of varying formats, of varying levels of completeness, and presumably very varying levels of reliability. So to look at that and somehow come to the right decision when it really, really, really matters, it's difficult. And just to give the background, I'm currently having chemotherapy at the local hospital, but I'm still able to go and essentially be a patient at the hospital where I had my original surgery to remove the big tumour that started all my cancer. So I'm able to see two oncologists. Those are cancer doctors. I have access to surgeons and things as well. In Japan, we can basically go to any hospital we like, whenever we like, as often as we like. There's no, there's no big deal. It's not like you have to kind of beg a consultant to write a referral letter. They typically do referral letters here, but it's just not a big deal. You just say, you can turn up to a hospital without a referral letter. You can turn up to a hospital with a referral letter that's very easy to get hold of. So I have basically two oncologists who, an oncologist is a doctor who specialises in cancer. So it's different from a surgeon who specialises in doing cancer surgery. They're a surgeon, they're not an oncologist, although one would hope they have quite a lot of knowledge of other things related to cancer, not just doing the surgery. So I've got two oncologists I can speak to. I've got the immunotherapist. I actually see the immunotherapist every week. The oncologist I see every 2 weeks for chemo, and the oncologist at the further away hospital, I saw him for the first time in about 6 weeks recently or something like that. So I've got various experts I can talk to. I can go and talk to anyone, really. But unfortunately, no one can really give me clear, specific information about what to do or what might happen. Firstly, when you have terminal cancer, which means cancer that's incurable, so it's basically going to kill you. The main treatment idea is to cycle through the different treatments. So you keep going with the treatment until it stops working, and then you go to the next treatment until it stops working, and then you go to the next treatment until it stops working. And then the patient has sadly died because the cancer is not responding to any of the treatments. As far as I can tell, in almost all cases, people die not from the original cancer, but from the cancer it spreads to. So when you have cancer, it kind of grows and spreads, and for reasons that I don't really understand, or maybe no one knows, when the cancer spreads to other organs, that's when it gets you. So at the moment I'm trying to decide, for example, between having the maximum amount of chemotherapy possible, or having lower dose chemotherapy to keep the side effects down. With lower dose chemotherapy, one issue is going to be maybe that the cancer starts spreading, or the cancer starts growing, because at the moment it doesn't seem to be growing, at least in my liver. Now you'd think it'd be very easy to go online, look on Google, find some comparisons between different chemotherapy regimes. Here's an experiment here's a clinical trial where 500 people were given chemotherapy once every 2 weeks, and 500 were given it every 3 weeks. And the trial decided there was no difference in treatment outcome. I'd expect, a lot of that kind of data. There's almost none, as far as I can tell. There are very, very few clinical trials where there are 1,000 people in the who have the same sort of cancer and same staging. A lot of the trials, particularly for my cancer, where it's a very rare one, is bowel cancer with peritoneal dissemination. These trials have handfuls of people in. They're comparing a group of 30 people to a group of 35 people and trying to draw conclusions from that. It's not unusual when you read of the trial where it says all the patients died before the end of the trial. It's terminal cancer stuff, which is pretty upsetting to read. Often in the trials, the scientific research about cancer, the difference that they measure is significant, meaning they know there's a difference there, but very, very small. So you might have a medicine which, medicine B compared to medicine A, gives on average an extra month of life expectancy. But you've got to balance that with the fact that maybe medicine B has a whole host of other side effects that medicine A doesn't have. And it could be a situation where average life expectancy is 12 months with medicine A, medicine B, 13 months. So what happens? You take this medicine for 13 months. That gives you an extra, or 12 months gives you an extra month, whatever. But you're putting up with those side effects. And those side effects might make some of your days not usable. When I have chemotherapy, for a start, it takes a day go to the hospital, sit there in the hospital bed for a whole day, having various drips, and then they give me a pouch. I take attach the pouch to a needle, stick it in my chest, or I've got a port here. Yeah, it's a bit sore and uncomfortable at the moment. And I have that for 2 days. And side effects makes the time harder to use. So these kind of things you're balancing. Although my skin is still red and blotchy, that's actually partly due to the colour spectrum that the camera responds mostly to. But it is still very blotchy because I had this terrible skin rash. I've stopped having the medicine that caused that skin rash called panitumumab, but I need a replacement because that was a very potentially that was a very effective medicine keeping me alive a bit longer. So I have to somehow choose a replacement. So for the time being, I've chosen a replacement called Avastin, which may be similar level of effectiveness, but a whole bunch of different side effects. The way Avastin works is it stops your body making new blood vessels, which is unfortunate because anytime you cut yourself or whatever, or if you got some internal bleeding or whatever, part of the healing process involves new blood vessels growing. So I'm now having a medicine with actually has some potentially fatal side effects. Right, high blood pressure, perforation of the bowel, so actually getting like holes in your intestines and stuff, which can be fatal within a few hours. Rush hospital and ambulance. The oncologist who's currently doing my chemo says that I can have this medicine Avastin without having to have a metal toxin to go with it. Other oncologists think that you do need a metal toxin to go with it. I'm very pleased not to be having this metal toxin. I was having one called oxaliplatin. It's a platinum-based poison, damaging my nerves, making life unpleasant. I'm very pleased not to be having it. But now, does it mean I'm having Avastin, risking those fatal side effects for absolutely no gain at all if Avastin only works with a metal toxin? So these are kind of things I'm looking at. And there is no one you can talk to about this kind of thing. The oncologists, the doctors can give their opinions. They're often not up to date with the latest scientific research. They mainly follow the protocols, the treatment protocols, so kind of outlined by the government, by the Ministry of Health, whatever. They're always a couple of years out of date because it takes a couple of years to develop. So I'm in a situation where there's not much information. The information there is poor quality or maybe good quality, but I can't judge if it's good quality or not, which is just the same as being bad quality, really, not knowing what to trust. And yet I have to make these decisions, choosing between options that might affect how long I live and what kind of condition I live in. So, yeah, that's what it's like to be struggling with cancer. And there's not a lot that can be done, really. I mean, in the future, maybe loads of meta-studies could be done where you look at clinical trials and combine the data. Hopefully, one day there'll be a lot more research that's not commercial, because it's non-commercial research is the really important stuff and is the tiny minority. Most of the research is very, very commercial. And when drug companies are investigating cancer treatments, it would be ridiculous if they didn't investigate the most potentially profitable ones. So those are not necessarily the best ones for patients, because there's not necessarily a link between profit and effectiveness. You might think there would be, but if you have a medicine that you have to take over a period of years, compared to one that you can just take one dose of and it magically cures the cancer, which one has the most profit in? Especially if the medicine that you have to take over a period of years, you need a whole bunch of medicines to go with it to deal with the side effects. So I hope some of that video made sense. I hope it didn't sound too moaning and complaining. Please do visit my Cancer Fund website, www.matthewdons.org. That's MATTHEWDONS.org. Thanks for listening.